Thank you and welcome to the show this morning. The topic this morning is President Obama's health plan, and we're fortunate to have with us this morning to talk about President Obama's health plan, Dr. MKanu1, who is the interim director of the Masters of Public Health program at Tennessee State University. And of course, Dr. Kanu, let me welcome you to the show this morning. And I might have confused your position and your situation at Tennessee State University, but I think that you are the interim director, are you not, of the Masters of Public Health program at Tennessee State University. Is that correct? That's correct. Okay, very good. And of course, we're delighted to have you here to give us an opportunity to hear from you in reference to President Obama's health plan. Now, Dr. Kanu, before we get into that, let's talk about Dr. MKanu, to have you to give us some information for this first segment about your background, your education, and some of the things that were important and eventually leading you to Tennessee State University. And then we'll, during the second segment, get into President Obama's health plan.
Thank you, Dr. Haney, for having me. I have a very interesting academic background. By that I mean I started with a bachelor's degree with honors in history from Frabe College, the University of Sierra Leone. I'm a native of Sierra Leone, a very small country in the west coast of Africa. I finished that and worked briefly in the government service, the foreign service, as some people would like to refer to it. We call it Foreign Affairs Ministry. And I was there for 2 years before I came to the United States in 1997 to complete a master's degree in medical anthropology at the University of Memphis, in Memphis, Tennessee. When I finished that, I developed an interest in public health. And so I decided to once again change my area of focus for my academic discipline from anthropology to public health. So I went to St. Louis University in Missouri and completed a master's degree there in public health before I eventually enrolled in the PhD program in public health also at St. Louis University School of Public Health. Since graduating, I accepted a position at the University of Memphis in the same department that I graduated from a few years back, and I served there as a project manager coordinating a HIV project. At the same time, I also taught courses in anthropology in the department. I stayed there until I accepted a position at Tennessee State University, which is where I am right now. So I'm there as an assistant professor. I've been there for about 5 years now. I came in August of 2005, and I was recently named the interim director of the master's degree in public health, which is still at this developmental phase. We are hoping that we will start this fall, but we have all the pieces together, and we are very excited to have that opportunity to start that program.
Well, we're certainly happy to have you here this morning to talk about what we consider to be a very, very important problem, and that is, well, a very, very important issue in a real sense, and that is the President's health plan. I think that what we've tried to do over the last couple of sessions is to talk about not only his health plan, but his education plan as well. Later we will talk about his energy plan, and so that will give us an opportunity to get from you what we would consider to be some very, very basic kind of information dealing with how the public can perceive Mr. Obama's health plan. What do you think about that health plan up front?
I think it's a very good plan. I think it's for two reasons to me, or at least in my view. Number one, it's very inclusive when you look at the various components. And number two, it's also very, very much, it's very important in emphasizing prevention, which is a component that sometimes we tend to believe that it's very important, but sometimes I doubt whether we actually give it the importance that it actually deserves. So it's very important, I think, in the beginning to set that stage so that people will understand when we talk about the relationship between medicine and public health, which is my own background. Medicine being that, you know, we're talking about clinical practice.
Okay.
It is a downstream approach where we wait for people, or maybe for lack of a better word, we say wait until they get sick, and then they go to the a clinical setting and have themselves be treated. Whereas public health tries to prevent the onset of disease in the first place. So again, just putting everything in a in the sound footing. When you try to understand the plan vis-a-vis how it relates to health prevention or disease prevention, I should say, and medical practice, it's very important.
And of course, we're going to take a first commercial break, and we'll be back with our audience following this very, very short commercial break.
Jobs faster.